So hi everyone, a very good evening to all of you. Today I'm here at the DAMS Daily YouTube channel to guide you through a very popular course at DAMS which is called as the Test and Discussion course. Now I've been getting a lot of messages on what should be the preparation strategy if one is enrolled with the Test and Discussion course, and how exactly you should be utilizing the resources that are going to be provided to you within this course. So this is going to be a detailed description and you must follow the strategy if you really want to improve your ranks and your number of correct questions. Now, when you talk about the test and discussion course, the current course that we would recommend at this time of the year is going to be the NEET or Next PG TND targeting 2024. Now, this is going to be a live course on the app. Okay, so it is going to be a live course on the app, and this is good for anyone who wants to prepare for both the exams, whether it is the November INI set exams or it is the upcoming NEET PG exams. Okay, the reason I say that is because when we talk about the NEET PG and INI set, the basic difference between the two exams is the vastness of the topics that are asked. So NEET PG usually is going to ask you a lot more types of topics, so which means the width of your preparation has to be more. The depth may be okayish, okay? But when we talk about the INI set, they have a limited set of topics which they are fond of asking, which they will ask. So the width is not that much. Okay, it is a narrow part or a narrow zone, but for every particular topic, they will go into quite a depth to ask you about that topic. So NEET PG TND is a course that we have specially crafted, which will cover both the parts. So we'll give you a fair number of topics that you should be preparing within a subject so that you take care of both the exams, for that matter, even UPSC exams. Okay, and the teacher is going to do a live discussion on each MCQ in a way that we know what depth are we going up to, right? So it will be very appropriate, which is what DAMS is known for, right? Concise, crisp, and conceptual teaching. So every topic will be done in an algorithmic format, in a format which is concising the topic so that, you know, your TND notes are something that you can revise even a week before the exams, and they turn out to be super high yielding. Okay. Now, as I said, this is going to be a live course on the app. So the first thing that you have to know is that when you go to My Courses, this is how it is going to, and you click on the NEET PG for 2024, this is how it is going to appear, right? Now, do you see the icon here? Now, this icon here, if you click on it, is going to give you the entire schedule, right? So this is going to give you the entire schedule, and the schedule can be seen like this. For example, the next test that is coming up on 24th of May is of medicine. We will specify what topics you're supposed to prepare for this particular test, and the time for the discussion is also mentioned. So similarly, what all is the order or sequence of the test is already there mentioned in the schedule for you. Now, if you join the course anytime till 6th of June, all the tests that have happened prior to this, so the subjects that have been covered prior to this would be repeated, right? So 6th of June tak, if you are joining, all the subjects that have happened prior to this will be repeated in a cyclical manner. So it is cyclical, but we can repeat it up till a certain date. So that is the 6th of June. So until that time, all the tests happened so far would be repeated. Now, having said that, when you look at the course per se, there is a section which provides you with the test, and then there is a section where you will see the live discussion. Okay, now I'm going to go through each of these one by one. So you are supposed to first give the test. So the test is made live about 1 to 2 days before the due date. Okay, so you can appear for the test on the app itself, and you will get overall ranking. You will get a detailed analysis, right, of what is the number of correct questions, wrong questions, your percentiles, your ranks, and so on and so forth. Now, before I go on to that part, what we need to know is that some of you might want to take up or prepare only for the November INI set exams, right? And maybe you've decided that you don't want to go up to the NEET PG. Then yes, there is one more option, which is the INI CT TND. But this one is going to be a pre-recorded course. Okay, so this is a pre-recorded course. This is not live. And this would cover only and only topics that the INI set is fond of asking. So as I said, the width will be less. But those topics that the INI set exams are fond of asking would be covered in detail. So that is why I said for someone who's preparing for both the exams, they should definitely take up the NEET PG TND. Also because attending the discussions live make it a lot more different than doing a pre-recorded thing. See, the problem with the pre-recorded is that the onus is on you. You have to sort of ensure that you are diligently appearing for the test, you are listening to the discussions, and then you're doing the review. Whereas when the course is live, you have a set target in front of you. This is the date. This is the date by which you have to finish these parts of medicine. So there is like this pressure on you, and some pressure, believe me, is required if you have to optimally, prepare, but keeping the time limit in mind. No, otherwise what happens is you just go on and on preparing for medicine and surgery and forget about the other subjects completely, right? So that is why having set targets and well-defined targets is very, very essential, and it is an important part of strategy. Believe me, hard work is important. There is no doubt about that. But most of you bachas are medicos. Hard work is in your blood. Okay, you are working hard. You're going all out. So the strategy sometimes takes the edge. So someone who's preparing with a good strategy may do a little better than someone who is not. Right? So that is why, what we recommend at this time is a live NEET TND. Having said that, since I said that INI set TND is a pre-recorded course, so the tests and all the videos have already been uploaded there. But you will have to do it by yourself. How I can help is, I am going to give you a tentative schedule. Now, this is only and only for your help. Okay, so anyone who cannot make their own targets can utilize this particular slide of mine, and you can set the targets in this way. So I have made the schedule starting from 22nd May, and I have given you the subjects by the time that you should be finishing them, keeping in mind definitely the importance of the subjects as well in the INI set exams, and ensuring that by 7th of August, you are done with the, sorry, one cycle at least once, right? So as I said, please don't misunderstand. This is a slide which I have completely prepared by myself for your help. This is not telling you that the test would be live on 22nd May. So don't think you will come live on 22nd May for an anatomy test or 25th May for a physio test. No. So as I said, it is pre-recorded, and all the tests and video discussions have already been uploaded. What I am simply giving you is targets to prepare for. Okay, so I'm simply giving you certain targets which are well defined. And you have to ensure that you are covering up the ground with this particular time limit in mind and then giving the test. Okay. Now, what are you supposed to do in the week that is given to you for the test, right? What are you supposed to prepare in that 1 week? For example, let's say your gynae test is coming up. The first and the most important thing that I want you to cover up in the gynae test is your class notes. You have to ensure that you are very, very thorough with this. So, you can further divide your 6 days with well-defined targets. For example, you can say on day 1, I'm going to finish the relevant anatomy, I'm going to finish the relevant physiology, and I'm also going to finish the relevant endocrinology, right? Similarly, on day 2, I'm going to finish this subtopic of gynecology. So please remember, we have given you a weekly target. It is always better to divide your day into well-defined targets so that we ensure that by the time that I am, finishing in this week, gynecology is not a pending subject. It is better not to have pendencies and try and cover up as much ground as possible in the week before the test. The first priority goes to your class notes. Yes. So ensure that you're doing them thoroughly and you do them anti-grade. Okay, so this is the time that you're going to do your class notes anti-grade. Start from the first page, go through everything, because this is the only time that you're going to go anti-grade, and this is the only time when you're going to go line by line. Okay, now once you have finished, or while you are doing your class notes and you have your daily targets, please remember that every day, apart from doing some anti-grade reading, the second thing that is very important along with this is practicing MCQs. So every day, you divide your day, some parts you are actively reading, and then some parts have to be dedicated to MCQ solving. Okay. Now, what are the MCQs that you would be solving in this 1 week when you are preparing for the test? So in the week before the test, I want you to go to your DQB section. Number 1, cover the topic-wise questions. Okay. So for example, if you are preparing for gynecology, there would be different subheadings. So you would see questions on infertility, endometriosis, fibroid, adenomyosis, and so on. Right? So one is start covering up topic-wise questions. So whatever topic you have read today, let's say you have read relevant anatomy, physio, endocrinology, then these are the sections that I want you to cover the MCQs of. The MCQs are a limited number in the topic-wise section. They are not many MCQs, so you can easily cover them up. Not just that, if you have to have a minimum level, you should be practicing at least 50 MCQs every day. And if you sort of reach 100, that is a good enough target. In fact, more than that is not very advisable, because then you're not reviewing those questions, you're only solving them. Okay. The second MCQ practice that I want you to do from the DQB is the section which is called as PYQs, right? So if you are dedicating today, let's say first 3 hours for anti-grade study, maybe we can have next 1 hour. So 3 hour, let's say, anti-grade reading of notes. And then you can dedicate the next 1 hour or even 30 minutes at one slot for MCQ practice, right? And in this 1 hour of MCQ practice, we can do topic-wise MCQs, but I also want you to cover the PYQs, right? They are in your DQB section at the top. So you see INI-CT PYQs, you see NEET PG PYQs, you see FMGE PYQs. So please cover the PYQs also in this particular week before the test. Okay, so these are the 2 things that I really want you to focus on in the week before the test. Also, please remember, whenever you are doing MCQ practice, reviewing is important. Okay, so review the MCQs that you have done, which means I want you to find out what are the topics or subtopics that you have done wrong. So which is why I keep specifying that whenever you are doing MCQ practice, you must make a wrong diary, right? So in this wrong diary, I don't want you to write the MCQ and the answer to it. What I want you to write currently is very specifically, what topic did you do wrong? Okay, so what topic did you exactly do wrong is what I want you to mention in the wrong diary, so that you know that, in today's day, I have done an anti-grade reading, I have done some MCQs, but it is important to go back to topics that you have done wrong and read them again. Okay, so this is really important to identify. Otherwise, the next reading that you're going to do, you will find it very difficult to do it in a short span of time. Only if you know specifically what things you have done wrong, you will be able to reduce the time for revisions every time. So let's say if you are doing gynecology in the first reading in 1 week, eventually in the next reading, you should be able to do it, let's say, in 3 days or 3 to 4 days. With the further reading, you reduce it to 1.5 days. And that is how it has to be, which is only going to happen if you make a wrong diary, right? What else? Please remember that you must follow the schedule, right? So it is very essential that you follow the schedule. Now, some of you, you have a gynecology test coming up, but you say, okay, I want to accelerate. I also want to study anatomy at this time, which is fair. You can cover 2 subjects at one time. Okay, and usually I will ask my students to combine one major subject and one minor subject. But ऐसा नहीं होना चाहिए that if a gynecology test is coming up, you eventually spend more time doing anatomy and then perform badly in the gynecology test. So that should not happen. Your primary target should be the test that is upcoming, so that you develop confidence that this is something that I have done. I am good at it, I'm average at it, or I am very good at it. If you focus on too many things at one time, the problem is that you will never reach a certain level in any of those subjects. Although you are getting a feeling that you have done anatomy once and you've done gynae once, but believe me, you will make a lot more mistakes. You will be unhappy with your performance, and then you will have a feeling that you have to read it all over again. So this is a vicious cycle and you get into a trap. So please understand, if you have to combine more than one subjects, let it be one major and one minor subject. Okay, and you can try and correlate them to study. For example, if you're studying gynecology, it's a good idea to cover some aspects of sexually transmitted diseases from, let's say, dermatology, right? If you are doing pelvic anatomy today, it's a good idea to do the same part from anatomy. So rather than trying to cover an entire subject with it, try and cover the relevant parts of some other subject, right? Which will help you not only in a sort of doing more than one subject at one time, but it will also help you in questions which are integrated questions, right? So this is a very common doubt that students often ask me, ma'am, that ENT test is coming. I don't need 6 days for it. I can finish ENT in 3 days. Can I do something else? So my answer is yes, you can cover something else, but provided you perform optimally in the ENT test. Suppose you say, okay, with ENT, I was reading medicine, and what has happened is that in ENT out of 75, I've got only 40 questions correct. Then this is bad. Okay, you will not be good in medicine, and you have wasted your time for ENT as well. So this creates backlogs. Please avoid that. As I said, your primary goal should be the test which is upcoming. You can add another subject to it. There is no harm in it, but the primary subject should not suffer. Okay. Now, as much as possible, please attend the discussion live. Now, this is again a strategy which I feel is underrated. You know what happens when you get the test paper? You feel कि ये आता है. Okay, but when you sit and attend the discussion live, you will realize so many places where your entire thought process was wrong. The approach to the MCQ was wrong. Maybe you find out the answer by ruling out, yes, but you have to learn the approach, because it is not necessary that the same question would come in the exam. They can do minor changes, right? So it is very, very essential that you learn the approach to the MCQ and not the answer. As I said, our USP is concise, crisp, and conceptual teaching. So, we will primarily target why A is the answer, why B, C, D are not the answers, what changes or what are the correct statements with respect to B, C, D. So this kind of a discussion also helps you in other forms of MCQs like multiple correct, like true and false, like match the following. Okay. Another thing that I want you to do when you're attending the discussion live is to make short notes. So, you would often ask me, ma'am, I have made my class notes in the regular class. Now am I doing TND? Should I make notes? My answer is yes. How do you do it is the key. So I don't really want you to sit with another notebook and have another notebook for anatomy and another one for biochem and another one for physio. No. What I want you to do is sit with plain sheets of paper when you attend the discussion. Okay. And in these plain sheets, you have to have a habit that you will write only in the form of points, only key things. So key words is what we are highlighting. Okay. For example, we could say most common. For example, we could say investigation of choice. For example, we could say, a specific finding on an MRI or an ultrasound. So these are the key things that I want you to write. I don't want you to write any paragraphs or sentences. This is the art of solving MCQs. You need to know the keywords. This is what I want you to practice when you are attending the discussion live. The faculty will always highlight the keywords. They will say that, okay, some of you have marked the answer as B, but it is not B, it is A, because look at the age of the patient. So then you know that if it is ulcerative colitis, the age is the key factor. And similarly, for other disorders, there could be other keywords. So I want you to develop an art of identifying keywords in a question and putting them down, because this is a reinforcement. Okay. So second thing I want you to do when you are writing your short notes with TND is make algorithms. The teachers teach you as algorithms. So we'll say the first step is do A, then go to B. If the answer to this is yes, then do C, and so on. So we will be giving a lot of explanations in the form of algorithms. This is the second art I want you to learn, to master MCQs where they are not simply focusing on your content, they are focusing on whether you can apply your content or not, which will only happen if you exactly know the application of what you have written. So this is very essential for clinical vignettes. Questions where they give you case scenarios, they ask you management protocols. So it's not always about diagnosis. It's not always about ultrasound findings. It's a lot of times about the approach. So always try and make short notes, use keywords, identify keywords, put them down, use algorithms as much as possible, flow charts as much as possible in your TND notes. And when you make these notes in plain sheets of paper, you can put it in your main copy. So if this was your gynae TND, use these plain sheets and put it in your notes copy so that you have them at one place. Please don't create another booklet for yourself for every subject. Don't do that. Then, suppose for some reason you couldn't attend the discussion live. So I said, although you should do it live, but suppose you couldn't attend the discussion live, the same discussion of your live classes are uploaded in the app, usually on the same day. Okay, sometimes if it happens to end late at night, so we'll put it by early morning, but usually on the same day, the discussion will be uploaded. So now my suggestion is, if for any reason you have missed the live discussion, then try and cover it up the very next day. Please don't put it as a backlog for too long. Okay, try and cover up, because if you keep creating backlogs, you lose confidence, right? So that is the next thing. Now comes a very important part, and this is a snapshot from one of my videos, which is called as creating the wrong diary or your 20th copy, right? So your 20th copy is actually your wrong diary, and it is available on YouTube. So you can look at the video by yourself as well. And it tells you how to review. So whenever you give a test, no matter whether it is a TND paper or a SWT paper or a grand test paper, if you are not reviewing it, then the benefit that you will get out of the test is less. The improvement that you will see successively will only happen if you are reviewing it. So you, let's say, have attended the discussion. Now what I want you to do is spend half a day tomorrow, okay, and make a wrong diary from your TND paper. Okay, so make a wrong diary from your TND paper. The three parts of the wrong diary are topics that I have done wrong. So these include topics that you might have done right just by ruling out. But because you're in the preparatory phase, you should consider them as wrong and read that topic again. The list has to be very specific. So please don't write the name of the big whole topic. I keep giving example of, PPH. So, if you've done the drugs wrong in PPH, you should write drug dose. Don't write entire topic is PPH. Otherwise, revision will take the same amount of time. As I've mentioned previously, please don't write question and answers. Write the name of the topic that you have done wrong. And it is very essential that you understand that these topics that you have done wrong will need intermittent revision. Okay, so they will need intermittent revision because they are probably your weak areas. The second column is topics that you have done wrong because they were volatile. So you simply forgot them. So, again, for these, you can write them as it is in the wrong diary so that it is in one place, and you can, go through these points before the exam as well. Some of the questions in your TND could be new topics. They could be based on updates. Now, listen to me very carefully. Please remember, if this new topic was something that you felt was new, but it has been covered in your notes, then you have to do it from your notes in the way it is done in the class. Okay? If it is a topic that was not in the class notes, then you have to give less priority to this topic, which means you have to keep your information about this topic very, very concise. So a lot of times, if we have given you, let's say, a topic about SLE in pregnancy, please understand in the TND, we will tell you the approach. We will tell you what you need to know. It is absolutely futile if you go back and spend 3 hours reading SLE in pregnancy. You're wasting your time, you're misguiding yourself, right? So for the topics that are not in your notes, you have to be very, very crisp. So actually stick to only the points that have been told in TND. Please don't do a Google search. Please don't go to ResearchGate and try and accumulate more and more information about it, okay? Whenever you're trying to collect information about a new topic from the internet, please ensure that it is an authentic resource. You can't simply do a Google search and then learn everything that is there on Google, because unfortunately, there is a lot of information there. So you have to know what to use. And that's exactly why I said you should actually not do the Google search. Keep or give this task to your teacher or faculty. Whatever we extract from it, we'll provide you, and that is it. That's what you need to do. So if you go and fetch information by yourself, it becomes too vast, too cumbersome to manage, and very difficult to revise. Okay, so this is about how to review your TND paper. The same reviewing process you should apply to your grand test as well. Now coming to the next important part. Suppose in the TNDs and in the grand test that you have given, you realize that every time you get a question on active management of third stage of labor wrong, then this means you are weak in that topic. Now listen to me very carefully. In the NEET TND, but not in the INI set TND, so only in the NEET TND, you have access to the back to basics, all 19 videos. Okay? Now these videos have to be utilized by you, especially for revising your weak topics. So if you feel that there is a topic that you are repeatedly doing wrong, then you should come back to the video, see it at a faster pace, and learn from it. Suppose you also think that for a particular subject, your notes are not very good or you are not very confident. Then in the week before the test, you can see these videos to prepare for that particular subject. Let's say my microbiology test is coming up and I have not done my first and second year subjects well. I only did the third and fourth year subject. So what do I do in the TND now? So for the first, second year or any other subject where you feel that your content is lacking, or you didn't make the content, or you're not very confident about it, then again, please use the back to basics videos. They are concise, crisp, and conceptual. Underneath the video, you have the soft copy of the notes, so you can see it right there, which helps you in forming a better visual impression of what you are listening. Yes? Okay. Then, coming to the next very important limb. In your TNDs, you also get access to the entire test series. So this test series gives you access to a lot of types of tests. So there are grand tests, there are subject tests, there are class tests, and there are also mock tests. Now, please remember how to use this. The class test and the SWT that you have here, this is a separate paper from your TND paper. Okay, so mind it, we are giving you a lot of MCQs to practice because testing is the way it has to be. Whenever you practice MCQs, the more tests you give, the better you get. So class tests and SWTs, I want you to use for your first revision. Let me explain you how. Suppose I gave the anatomy test 2 months back. Yes. Now I feel that anatomy is very volatile and I have forgotten it. What do? I'm having a FOMO कि मुझे anatomy याद ही नहीं है. अब मैं क्या करूं? So should I again go back to anatomy or should I read for the test that is coming up? So remember my rule number 1. The primary goal should be the upcoming test. But now I want to really go back to anatomy because it's giving me really jitters. So what do? If you feel that you're forgetting something, we have to do a spaced revision. And for this spaced revision, I want you to use the SWTs and the class test papers. So for example, today whole day, I was studying for my primary test. Let's say it was surgery and I am done for the day for surgery. Please spend some time at night, okay, before you sleep for revising something old. Okay. So this time span can be as little as 1 hour. So let's say every day at night, I'm going to dedicate 1 hour to revise something old. How do I do it? So there are 2 formats. Number 1, to revise something old, what you can do is you can open up your wrong diary. So isliye the sooner you start making the wrong diary, the more use you can make of it. For example, let's say I had made a wrong diary for anatomy and today I feel that I really want to revise anatomy. Don't start from the first page of the notes, bache. Okay, it is a never-ending task like that. You have to now go selective. So very important. The revisions have to be more and more selective. They should not be anti-grade, they should be retrograde. So you have read for your first time for the test, you were reading anti-grade. But now when you want to revise the same subject, it has to be retrograde, which means either you use your wrong diary, see what were the topics in anatomy that you had either forgotten or did wrong or were new. So these are the topics that you should be revising first. Okay, so do not start from the first page. The second way of doing a spaced revision is now give a test again. So now don't repeat your TND paper. You have 2 other test papers for you. So you have a class test paper, you have a subject-wise test paper. These are made with different ideas in mind. The class test papers are made in a format that they are testing your basic knowledge in every important topic of that subject. The SWTs, on the other hand, are made in such a way that they are covering the last 5 to 7 year PYQs for you. So use these test papers. So first, give the test, see what topics you have done wrong in these tests, and then these are the topics that you should be revising first from your class notes. So revision should always be retrograde. And if you can see what I'm telling you, revision and reading go hand in hand. Revision is not to be kept for last. Every day 1 hour, not more. Every day 1 hour has to be dedicated to revise something old. Is that clear to everyone? Okay. Then you keep following the same protocol. And yes, gradually you have to increase the frequency of grand tests. So this is what I believe, that if your baseline in the number of correct questions in the GT is less than 120 right now, okay, I'm talking about middle of the year, then you should be giving it once a month. Because here it means it is not about simply giving the test, you have to work on your content as well. So you have to spend time giving a GT and also spend time in reviewing it the way I taught you, by making a 20th notebook with your wrong diary. And between one and the other grand test, you should be trying to revise some of the wrong topics that you have done. Okay, if not for all 19 subjects, as I always say, you can start with some subjects. So you can start with your bottom 3, then manage bottom 5, and so on. So as you keep going further, you will increase the number of subjects that you can review. I also say that because a lot of times in the GT, you are doing it wrong because that subject has not been covered so far. So don't bother about it, bache. As you prepare for TND, gradually your scores will improve. So first, follow the 3-column strategy or wrong diary for the subjects that you have covered in TND. Gradually, as you cover more subjects, you can extend the reviewing to other subjects as well. So you keep doing this. This is for less than 120. If your number of correct questions is more than 120, then you can give once in 15 days. This has to be the protocol for first 3 months, okay, or 2 to 3 months, and then we will increase the frequency. So if you are initially doing it once a month, you will increase to once in 15 days. If you are doing it once in 15 days, you will increase to once in 10 days. And every month, you will change the frequency. Towards the end, you all have access in the TND to short courses. So the most important ones, PYQ ka baap. This is something that you should again do towards the end when you're approaching the exams. So mind you, you have covered PYQs while preparing for the TNDs, but now we will do a quick review where we have last 5-year papers, their discussions by the faculty. So in PYQ ka baap, so this is something to be done close to the exam. DVT is something that is to be done close to the exam. Similarly, AIIMS PG capsule is something that you should be doing close to INI set exams. Emergency case rooms are also something that should be done close to the INI set exams. So various short courses have been given to you, which will help you cover the vastness of 19 subjects in a short span of time close to the exam. Also, apart from this, close to the exam, you will again be using your wrong diary. So close to the exams, what will be our resources? Our resources will be our wrong diary. Okay. Our resource is going to be the short courses like DVT, like PYQ ka baap, okay, and AIIMS capsule, right? So these are going to be the resources that we will use for retrograde revision close to the exam. Close to the exam, again, we can't go retrograde. Remind you what I said. I said every time you do a revision, your time has to be less. You have to go more and more selective, right? So this is a broad overview on what strategy you should be following with TND. And how do you see whether you're on track or not? You have to keep a watch on your number of correct questions in the TND, in the GT. If your graph is moving like this, you are on the right track. Don't worry about your percentage. Don't worry about your rank. Please worry about your number of correct questions. Okay, and that's how the graph should look. We have to target reaching, 140 to 150 correct questions consistently, because then there will be a phase of plateau, and then I'll guide you further on how you can further improve it once you reach that level, right? So here is wishing you all the very best. If you still have any doubts about the TND, And how to go about that, please feel free to message me on Telegram or Instagram. So hope you make the best use of the resources provided to you. Take care, everyone. God bless you.